the HIV infection and the treatments associated with it, and some other non-common conditions. Lipodystrophy has two main consequences. The abnormal fat redistribution can be either abnormal fat loss or can be abnormal fat deposits. When we see with the HIV lipodystrophy syndrome is that the lipoatrophy or the fat loss happens basically in the periphery of the body, which is the face, the buttocks, and the extremities. On the other hand, lipohypertrophy or abnormal fat deposits happen basically in the center of the body. And what we see affected is the neck, both sides of the neck, both the front and the back of the neck, the chest, abdomen, and pubis. Basically, we are going to be discussing in this section about lipoatrophy that, as I said, affects the periphery of the body, and we see what we know as facial wasting, gluteal lipoatrophy, and limb lipoatrophy. The social impact and consequences of the HIV-related lipodystrophy syndrome are many. Basically, this condition is a disfiguring disorder that affects middle-aged, economically active, healthy individuals, interferes with the social interaction, and creates a big deal of physical and psychological damage to the individual, creating isolation and social isolation, and depression. I published a paper a few years ago where we created a classification of facial lipoatrophy or facial wasting, and we thought that based on the experience that we had back then, this will be divided into 5 levels. Lipoatrophy, the facial wasting or facial lipoatrophy, level 1, basically cannot be a big issue. It's just a tired-looking face. The cheeks are minimally flattened, and the changes may not be noticeable, not even for the patient. By instance, the social and working environment is not affected. As you can see here, is a fairly normal-looking patient with no signs of anything except for the trained eye that we can see little signs of lipoatrophy in some areas of the face, but no major deal. Facial wasting level 2 is a little more, the individual is a little more affected, and it looks like a prematurely aged face where we can see the cheeks and the temples are flattened, the nasolabial lines are slightly exaggerated, and the changes start to be noticeable for both the patient and his close friends and family. The social and working environment at this point is not yet affected. You see here, you can see a little bit of flattening in the upper cheeks. The temples look a little flattened, and the nasolabial folds are a little exaggerated. Facial wasting level 3, it is important already. The face looks sad, prematurely old, saggy. The cheeks and forehead, chin and temples are flattened. The nasolabial lines are exaggerated by a fold that develops on top of them. And the patient is continuously questioned about health problems or severe weight loss by individuals close to them. At this point, the social and working environment is affected. You can see a very young individual, and you can see signs of fat loss all over the face. Facial wasting level 4, it is very important already. The face look emaciated, sick. The bones and muscles of the face start to show through saggy, prematurely old looking skin. The forehead and the eyes are sunken. This creates what we in medicine know as enophthalmos, which means like sunken eyes. And the HIV stigma is very apparent at this moment. And of course, the social working environment is very effective. You can see here another young individual that looks very affected. Basically, there are only reminiscences of fat in some areas of the face, but it's mostly lost. Level 5 is the maximum level of affection for facial wasting, and the face looks cachectic. You can identify the facial bones and the muscles of the face. The enophthalmos, or the sunken eyes, are severely affected, and the HIV stigma is unquestionable. Of course, at this point, the social and working environment is ruined. Basically, you can see here in the center, the picture in the center, that there's no fat left in the face. As we mentioned, the wasting affects also the buttocks, and I have also created a classification for this. Level 1 of buttock wasting is not noticeable. Basically, the changes are not noticeable for even the patient or the physician, and there is no affection of the function. The patient can sit with no problem. Level 2, the cheeks are flattened, the anus start to expose, and both shape and function are already compromised. The patient cannot sit for longer periods of time, especially in hard surfaces. Buttock wasting level 3, the cheeks are extremely flattened, the anus is exposed, the skin is really saggy, and there's a big loss of shape, and sitting is very affected, is uncomfortable or painful. And finally, buttock wasting level 4 is a complete loss of fat in the area, the anus is exposed, the skin is saggy, and it is extremely painful to sit, and distressed skin and pressure ulcers are common. In this picture, you can notice some red dotted circles. These patients specifically have hard silicone implants that are shown under the dotted lines. This is what I think a disastrous correction. We'll address that later. And finally, the distal body lipoatrophy, or the limb lipoatrophy in patients with HIV, is noticeable both in the arms and the legs. The patient shows like pseudo-athletic, or the muscles look like if they were hypertrophic. The veins and the extremities are very noticeable, and but eventually both the arms and the legs start to thin out. What are the treatment options for the lipoatrophy related to HIV? Basically, we have three options, all of them focusing on replenishing the lost volume. The first one, and my favorite one because of the results, is the use of soft tissue fillers. The second one will be fat transfer. And the third one, which is my least favorite for this condition, is the hard silicone implants. We will be discussing